The Okaka Community Primary Healthcare Center in Yenagoa, Bayelsa State, South Nigeria, is saddled with the responsibility of providing basic healthcare services to the residents in this corner of the state. But the center is suffering from a sad lack of attention. They have not been supplied with drugs or equipment since 2014.
80% of what we have here, we did it ourselves. I can say due to the little work we've been doing, we've been able to buy one or two things. We have an improvised labor bed. We've applied to MDG twice to help us with beds, which they've not responded to.
At another center in the heart of the city, the tale is no better, with the health facilities situated on a temporary site. Space is limited, and a lot of the equipment is stored outside. At a center in Cross River State, it's the same story. The place is seen to be manned by one nurse, but the state government says that will soon change. A one-time official of the Nigerian Medical Association in Ogun State, southwest Nigeria, laments a situation where people visit tertiary health centers to treat malaria and get vaccinated. Cases, he says, should be handled at the lowest level of care.
Number one, it is cheaper and it's better to run. And more people will benefit from it than curative that you have to go to all these tertiary centers.
Centers in some local government areas of Osun State are busier than most, but it's obvious the facilities have seen better days. Collins brings his daughter for treatment and hopes that his pregnant wife will deliver another baby in the only primary healthcare center in Avu local government area of Imo State, southeast Nigeria.
The best of their capacity, they tried to make sure, as you can see now, she's very, very healthy. And my wife is pregnant again, and I've still brought her here again. So what I think the government should do for them is to improve them. As you can see now, they are lacking basic amenities like light.
Residents, medical staff, and even the state government agree that Kaduna primary healthcare facilities leave much to be desired at the moment. But the State Health Commissioner explains that there's been an unprecedented level of investment in the sector. In spite of the inadequacies, residents at Lugbe village in Abuja see the center as a lifeline. The Minister of Health, who visited the facility in Kuchingoro village in Abuja, intends to raise the standard of at least 10,000 centers across the country.
What we want to do is to bring health to the doorstep of our people. And the only way to do that is to deliver health through a network of functional PHCs. And this one represents one of the PHCs that we tend to have all over the country.
It is reported that 1% of the consolidated revenue would go to the health sector, and some of this money will trickle down to primary healthcare centers all over the nation. Perhaps then more people will receive better services at the grassroots level. Mary Alale Yusuf, Channels Television News.